Hi, I am Kayla, your certified diabetes educator. This video is designed to help you become more successful in managing your diabetes. Hello, Mrs. Johnson. It's good to see you again.
It's good to see you as well, Kayla.
Mrs. Johnson, I spoke with your doctor and he has informed you've been diagnosed with type 2 diabetes. What do you think about that?
I'm scared. I have an uncle with diabetes and he is on kidney dialysis.
Mrs. Johnson, there are things you can do to prevent you from having kidney problems from your diabetes. Do you have any ideas what you can do to keep your diabetes under control?
I know my uncle had to stop eating sweets and he was taking pills, and then he had to take insulin shots.
What would you like to know about your diabetes?
I want to know how to start getting better.
Mrs. Johnson, there are 7 habits associated with managing your diabetes. They are healthy eating, being active, monitoring, taking medication, problem solving, reducing risks, and healthy coping. Usually we start with diet and exercise. From those options, where would you like to start, Mrs. Johnson?
I would like to start with healthy eating and being active. What should I do?
Is there anything you eat that you think is making your sugar go so high?
I know it's those sweets and that soda I like to drink.
That's right. It's sweets and also carbohydrates like rice, bread, pasta, potatoes, or tortillas. Would you be willing to cut down or even discontinue eating any of those things?
Yes, I'd be willing to do it in order to manage my diabetes.
Great. Why don't we make an action plan?
Hello, Mr. Rivera. It's good to see you again.
I am well, Pedro. It's good to see you again as well.
Mr. Rivera, when we last met you set healthy eating goals for yourself. Would you be willing to share with me how you are doing with achieving your goals?
I am doing very well with my healthy eating goals, Pedro. I've been including more fruit and vegetables in my diet and drinking more water. I've even lost 4 pounds.
That's great, Mr. Rivera. All your hard work is paying off. Mr. Rivera, are you happy continuing working on your healthy eating goal, or is there anything you would like to do for your health in the next week or 2?
Pedro, I would really like to start being active to better manage my type 2 diabetes.
Mr. Rivera, do you have any ideas on how you can become more active?
Yes, I do. There is a recreation center in my community that offers a free walking program. Some of my neighbors participate in the walking program 3 times a week.
Mr. Rivera, that's a great place to start. Some people find that it helps to get really specific about their plan. What do you think about that?
That's fine.
Okay. When would you like to start the walking program?
I am ready to go tomorrow.
That's great. What time?
The walking class starts at 6:30 p.m. on Mondays, Wednesdays, and Fridays. The group walks for 30 minutes.
That sounds like fun. How frequently do you think you can do it?
I can do it all 3 days. My wife has said she will come along with me.
Great. Just so that I am sure that I understand your plan, can you please repeat the details of your plan to me?
Sure. Starting tomorrow, I will start walking with the walking group at my local recreation center at 6:30 p.m. on Mondays, Wednesdays, and Fridays with my wife for 30 minutes.
That sounds like a plan. On a scale of 0 to 10, where 0 is not at all confident or sure, and 10 is extremely sure, how sure are you that you can complete your plan?
It would be an 8.
What would make it a 9?
Pedro, I feel sure I am able to reach my goal. However, if the weather is bad, I might not be able to go. Other than that, I feel very confident that I will walk 3 times a week.
Mr. Rivera, I feel confident that you will reach your goal. How about we arrange to meet in 2 weeks to discuss your successes with healthy eating and being active?
Pedro, that sounds like a plan. I look forward to seeing you in 2 weeks.
Okay, Mr. Rivera. See you then.
Hello, Mrs. Khan. My name is Mary. I am a registered nurse and a certified diabetes educator. How are you today?
I am fine, Mary.
Mrs. Khan, your doctor said that she just informed you that you have type 2 diabetes. How do you feel about that?
I am feeling a little overwhelmed. I know very little about diabetes and don't know where or how to start taking care of myself.
Mrs. Khan, would you be willing to share with me what you understand about diabetes?
Yes, Mary. I remember that it is something to do with having too much sugar in the blood and that if I don't take care of it I can go blind or have an amputation.
Mrs. Khan, poorly managed type 2 diabetes can lead to those types of complications. However, diabetes is a condition where your insulin isn't adequate to get sugar into your cells, so your sugar stays in the blood and over time can cause complications. Mrs. Khan, would you be willing to share with me your understanding of diabetes?
Okay. Now I understand that diabetes is when there isn't enough insulin to remove the sugar from my blood. But Mary, how do I know whether there is too much sugar in my blood?
Mrs. Khan, you can know this by measuring it with this blood glucose meter. This is for you. It's important to develop the habit of monitoring your blood glucose levels daily.
Thank you, Mary. How do I use it?
Mrs. Khan, you will receive detailed instruction on how to properly use your meter at your diabetes education class after this visit. However, included with the glucose meter are all that you need to check your blood glucose, such as the meter, a lancet device, lancets to pierce your finger in order to obtain a blood sample, a logbook, and test strips. Monitoring your blood glucose regularly and logging will help you understand how what you eat, physical activity and medications affect your blood glucose level. Mrs. Khan, would you be willing to share with me the importance of regularly monitoring your blood glucose level?
Yes, if I monitor my blood glucose I can see how the foods I eat, the medication I take and how my activity affects the amount of sugar in my blood.
That's correct, Mrs. Khan.
Mary, is there a specific number that my blood sugar level should be at?
Yes, Mrs. Khan. Your blood glucose target when you haven't eaten or when you've been fasting or after an overnight fast should be between 70 and 130. 1 to 2 hours after you have started eating a meal the target is less than 180. You'll see the number displayed on the face of the meter. Mrs. Khan, would you be willing to share with me the blood glucose targets you should aim for?
Sure. 70 to 130 before I eat or fasting and 181 to 2 hours after I start eating my meal. This information is helpful, Mary, because my holiday Ramadan is coming and I fast.
Hello, Mr. Singh. My name is Judy. I'm nurse and a certified diabetes educator. It's nice to meet you.
Very nice to meet you too, Nurse Judy. Nurse Judy, as you requested, I brought along with me my medication and my logbook.
Thank you, Mr. Singh. Mr. Singh, you've been consistent with logging your blood glucose levels. However, your fasting and after-meal blood glucose levels over the past month have been outside the recommended target range. Would you be willing to discuss what might be contributing to this?
Nurse Judy, if I could venture a guess as to why my blood glucose levels are high, I would say it is because I don't take my medication regularly.
Thank you, Mr. Singh. Is there something that is preventing you from taking your medication as your doctor prescribed, Mr. Singh?
Nurse Judy, nothing is really preventing me from taking the medication. My preference is to manage it by eating healthy and by exercising.
Mr. Singh, I understand is that preference is to manage your diabetes through lifestyle modification even though your blood glucose levels have been elevated over the past month.
Nurse Judy, I am not happy that my blood glucose levels are high at the moment, but the medication gives me bad stomach aches. I believe over time my sugar levels will stabilize.
Mr. Singh, are the stomach aches you described preventing you from taking the medication as your doctor prescribed?
Yes.
Mr. Singh, I see that your doctor prescribed metformin. Do you know how many milligrams it is and how often you should be taking it?
Yes. It is 500 milligrams and my doctor said I should take it twice daily.
Okay. Mr. Singh, May I share with you what some of the patients find helpful to reduce the side effects of metformin?
Certainly. That would be helpful.
Some patients find taking metformin with their meals minimizes the abdominal discomfort. Mr. Singh, is that something you would consider doing along with healthy eating and being active to bring your blood glucose levels within the target range?
Yes, Nurse Judy. I'd be willing to do that. My health is very important to me.
That's a positive attitude, Mr. Singh. Let's schedule a visit in 2 weeks to follow up with your plan.